So we want to look at they call the FemExam card. Alright, there's like a difference between here. Let me just show you guys how it's properly spelled. So the Fem, right, is small letters, capital F though. Then the exam has to start with what? Capital letter, because it's like a feminine or female examination. So it's a test that is actually done for bacterial vaginosis. Okay, it's a test that is usually done for bacterial vaginosis. So what we have for the Fem card is it's a point of care diagnostic tool. It's designed to help clinicians to identify the cause of vaginal symptoms, especially bacterial vaginosis, trichomoniasis, vaginal candidiasis, right? So how it works, it actually contains two areas, just very simple. You have the pH testings, then you have the amines. Okay, so pH testing, of course, you want to look at the pH of the vagina. The normal pH to be about 3.8 to about 4.5. Okay, so once they see the pH is out of this range, you can suspect a lot of things, right? The amine test, I think I was trying to add potassium hydroxide, 10% of it, to see if there will be any odor that will be released. So from here you can be able to suspect a lot of things, right? So this is how the FemExam card looks like. Just two things can help you diagnose a lot of conditions, right? So the pH area is just to check if the vaginal pH is elevated most of the times. Amine test is now to dictate volatile amines, okay, basically product of what? Anaerobic bacteria, okay, but of course it's adding potassium hydroxide. So result appears within 2 minutes, so it's very fast. Okay, so two positive signs show that there's bacterial vaginosis. If one is negative, that's, I think, the pH. Yes, I think the pH, the yeast infection shouldn't affect the pH, right? So if the yeast infection, yeast infection shouldn't affect the pH. Yeast infection shouldn't also affect that volatile amines. Like, there should be no odor. Okay, so if it is too negative, it shows that there is a yeast infection. So it's very nice. Okay, it's quick. So advantages: quick and easy, disposable and portable, built-in controls, it's cost effective, it's cheap. Okay, so it's sensitive, 91% sensitive, it's specific. Okay, so they mostly use it in areas where they don't really have access to good healthcare systems. Okay, so you can always use this and make progress.